we brainstormed and developed strategy that was going to fit within the structure that we had. We used what we would call best practices. The network that Fahari Jamii has and its operations were quite fitting for that kind of arrangement.
We had to develop agile approaches in programming and working with the county to say what are the priorities that you have. The two counties were slightly different in their approaches because the contexts are very different. So I think, county-specific context in implementation was a big lesson.
USAID Fahari Jamii has been very instrumental. We know that for demand creation, they were able to support health workers looking at the community health strategy focal persons in the 17 sub-counties and even organizing for us stakeholders meeting.
Fahari Jamii also supported us with logistical and material supplies, like they bought for us tents, chairs, tables. Those are the items that we used to carry as we go out for outreach services.
Some of the activities were outreaches that were outlined that would help us to reach the populations in areas where they are, whether it is their work areas, whether it was the learning institutions, even the people who are at home and had not come to the health center were to be reached at their areas of residence with the vaccine.
Through this support, we are the leading county in terms of scale up of vaccination. We're actually the leading county with about 59% of our adult population fully vaccinated against COVID.
Through the support of Fahari Jamii, we were able to call together all the stakeholders in the sub-county. They would come to the meeting, we would have a dialogue together with them and give them a message that they would give to the respective people that they would be leading.
Tumeweza kujaribu kuweka utulivu na pia kuweza kuhamasisha jamii yetu hapa umuhimu wa chanjo na pia kuelezea pia madhara ya kukosa kuchanjwa.
We needed to have data entry done to allow us to analyze where we are finding most of the clients, who we were finding, who had we not yet reached, and we would be able to make decisions on how to reach them and where they were accessible.
Our data capture reporting and the reporting tools, we did it with, for the electronic ones, it was M-Chanjo for registration and administration of the vaccines. And then we had the DHIS, that is District Health Information System. It captures the data on daily basis.
We've also had some joint supervision together with them, going to facilities, checking the records, checking the vaccine, the storage, and also how they capture the data.
The data help us a lot, especially for Fahari Jamii. At least it helps me to forecast the vaccine needs for each facility. So if it is a high volume facility, we give, at least we know this one we are supposed to supply them more.
When we're talking about integration, is basically putting it as part of routine vaccination, where people can access it not in a specific site, but if you go to an immunizing facility, you get it as part of routine vaccination.
From the triage desk, we have also registration desk. We have a trained HRIO. There is a system called M-Chanjo. You log in, and then you put the client's identity, and then you'll see if the client has been vaccinated or not. You'll see if the client has been given first vaccine or second, or the client need booster.
We were able also to integrate the COVID vaccine into other facilities, because when it started we had picked our public facilities that were doing the COVID vaccination. But through Fahari Jamii project, we were able to integrate to ensure that the vaccines reach to the last facility.
We have also embraced the integration agenda, which we started towards the end of last year with the USAID Fahari Jamii team. We have built capacity for about 158 sites, and so we are doing integration of the vaccine alongside other vaccines.
We've transitioned the services from primarily standalone services to being integrated. We also have extended the same to ensure that members of the community are served out in the community and in social spaces.
Ukipata mtu anakushika mkono wakati uko na hitaji, huyu ndio rafiki.